As healthcare institutions strive to meet the regulatory requirements of the future, they recognize that today's healthcare environment requires agility and flexibility in order to achieve transformation. Standard Register's SMARTworks Clinical Enterprise provides scalable solutions that bring added value to your technology investments. Our technology, combined with the right-sized deployment resources, will help you accomplish your objectives, enhancing the speed to value of your technology solutions. Let's see how that value is delivered by following our patient Emily throughout her hospital stay. When Emily arrives in admissions, she is registered in the hospital information system. The registrar scans Emily's ID along with her insurance card into our system, which provides a legible record of patient data immediately accessible across the enterprise. SMARTworks Clinical Enterprise then processes the scanned ID using multiple financial, governmental, insurance, and banking sources to verify Emily's identity. It can also report additional information regarding Emily's ability to pay, reports of fraudulent activities, or other types of information of which your organization may need to be aware. The results are immediately available for the registrar to view and can be sent directly to the electronic record. Next, the registrar takes Emily's photograph. This photo is embedded in her record and can be applied to any documentation, including her patient ID band. When paired with a positive patient ID process, such as procedural timeouts or medication administration, photos support patient safety goals. Photographs can also provide an effective deterrent for medical identity theft and fraudulent activity. During the admitting process, Emily completes her registration documentation. Using hospital-defined rules, Emily's forms are automatically displayed. She can complete them electronically using drop-down menus, checkboxes, electronic handwriting, or by typing. Emily can provide her authorization through a secure electronic signature. The completed documentation routes to Emily's electronic record and triggers the distribution to the necessary departments. To correctly identify Emily's records, SMARTworks Clinical Enterprise automatically creates and applies barcodes with her medical record number, encounter number, and form ID. Before Emily leaves registration, SMARTworks Clinical Enterprise automatically generates a history of Emily's prescriptions. This is the initial step of the required medication reconciliation process, which supports patient safety goals and helps you achieve meaningful use. By bringing information together from the ancillary departments, it also improves clinical outcomes. Each of the previous steps during the registration process have been augmented by a standard register solution that has been designed to improve the overall registration experience. In each step, electronic data is captured and shared with your systems immediately. Now that Emily has been admitted, she is escorted to patient care. Awaiting Emily's arrival in the patient care area, her nurse retrieves the documentation at her workstation and uses it to initiate Emily's plan of care. The nurse can also print any additional documentation needed for Emily's chart on demand. SMARTworks Clinical Enterprise can ensure that the correct patient information is applied to the most current document every time. Should Emily need to sign any additional documentation throughout her stay, the nurse presents a device at Emily's bedside where she can review and sign electronically. This documentation is then attached to Emily's electronic record. This process is fast, easy, and paperless. Upon discharge, SMARTworks Clinical Enterprise provides Emily with personalized discharge documentation and follow-up instructions. After discharge, when the chart arrives in the HIM department, the staff scans Emily's remaining paper documentation into her electronic record. The barcodes allow automatic indexing into the electronic record, eliminating error-prone manual data entry. The information is now immediately available throughout the facility, so the HIM staff can focus on other tasks. If for any reason the hospital systems go down, SMARTworks Clinical Enterprise downtime applications can provide business continuity. Caretakers will be able to recall patient information and provide printed documentation complete with barcodes, which can later be scanned into Emily's electronic record. SMARTworks Clinical Enterprise has made documentation of Emily's care easy for both her and the hospital staff, and it's made an immeasurable difference to the hospital, improving the accuracy and accessibility of vital patient information, promoting patient safety, supporting core compliance measures, improving efficiencies. SMARTworks Clinical Enterprise. Quick to deploy, easy to use, the right solution for a rapid return on your technology investments.